Okay, now I understand why you came to chiropractor, but I want you to understand why I am a chiropractor. You see, I've been practicing for 34 years. My father practiced for over 65 years. So we were raised in chiropractic. I'm the oldest of 6 kids. And I have to tell you, from the time we were children, the only doctor visits outside of my broken arm and my sister getting stitches in her head was just the annual checkup before you went to school. And I'm not saying we would ever deny medical attention, but we were that healthy that we really never needed it. And now I'm 63, the youngest is 51. We have 7 kids between us. There's 4 grandchildren now. And I argue to find a healthier family that's really never really needed medical attention. And it was about chiropractic care, good nutrition, enough rest, a lot of TLC, and putting this body in the environment for it to do its job and be healthy. So a lot of people, when they become chiropractors, chiropractic kind of transformed their life or saved their life from something. Now my chiropractor, Dr. Russo, he was an asthmatic kid. He was in and out of the hospital with pneumonia several times. And his parents were at their wits' end on what to do when someone suggested going to a chiropractor. So they wound up coming to my father when Roger was 16 years old, and within 6 months, everything started to turn around. No more asthma attacks, no more pneumonia, and Roger knew from that early age that he was going to be a chiropractor, and he's been practicing over 40 years, and he's my personal chiropractor. So I want all my patients to understand what's going on in their body and how chiropractic can help them. So first, a few basics that we need to understand is first, the body heals itself. And that kind of sounds like we all know that, but really understand that the body is designed to heal itself and adapt and function normally. That's what we call the law of homeostasis. And we also want to understand that the body is controlled by the brain through the spinal cord and nerves. The brain sends out electrical impulses out the spinal cord, down the nerves to every tissue, gland, organ, and muscle in the body. And the body sends information back to the brain, let it know what's going on. Hundreds of millions of messages every second just for the normal function of the body, or for the body to function normally. And that's really what health is. When all the systems in the body are functioning the way they're designed, we have health. So my job is to educate people on what health is and to create a nervous system that's not interfered with. And I want to go into that now. So the spine is made up of 24 bones separated by a disc attached by tendons, muscles, and ligaments. And as we bend and twist and move, it's not a rubber hose. It's 24 bones all moving in unison to give us the support and the movement at the same time to never affect the spinal cord and the nerves. But what happens, it could be little things done over a period of time, or it can be big things like car accidents or sports injuries or falls and things of that nature. But the end result is the same. We can get a spinal bone or several spinal bones that shift out of their alignment and get stuck in that position. When that happens, the hole where the nerve comes out gets closed down. We get a hard bone compressing a soft nerve, and we get an actual interference in that impulse from the brain to the body and the body to the brain. Now, when that happens, we can have symptoms or pain at the level where the nerve's being irritated. That's be typical neck or back pain. Or we could have pain or symptoms wherever that nerve goes. So sometimes in the lower back area, we'll get pain going down the leg if there's a subluxation in the lumbar spine. In the lower neck, sometimes we could get interference or pain or symptoms down the arms into the hands. But also those nerves go to the organs. So in the lower neck, if there's a pinched nerve, not only do we get pain or can get symptoms down the arm, we can get problems with the heart and lungs. That's why when people have a heart attack, their left arm can go numb. It's all off the same nerve distribution. So the job of the chiropractor then is to find out where this bone is misaligned and locked out of the position. We call that a subluxation, bone out of place, putting pressure on the nerve. then use a variety of different techniques to adjust the bone back into its normal position, take the pressure off the nerve, relieve the irritation, and allow that nerve impulse to go from the brain to the body and body back to the brain so the body then can heal and function normally. Sounds simple enough, and in theory it is. But what we have to understand is that when that spinal bone has been out of its normal position for a period of time, the ligaments, the supporting structures, model to that position. They will physically change shape. They will get longer on one side, shorter on the other. If there's been trauma, either micro traumas or macro traumas, there'll be adhesions and scar tissue with the ligaments. And the adhesion and scar tissue don't move or stretch or is flexible like normal ligament tissue. So that'll kind of cement it in place. So even though the chiropractor, I can move the bone relatively easily, what do you think is going to happen to that bone in a short amount of time? Right, it's going to go back eventually, hours, maybe days, to the misalignment. So the way we don't allow that to happen is we don't allow that bone to keep going back out of alignment. We want to maintain it in its normal position long enough for those ligaments to heal and model to the normal position, which they do over time. And every adjustment will break up the adhesions and scar tissue so that alignment will restore the normal alignment and normal movement. Now that process will take anywhere from 6 to 8 weeks to stabilize it. Not that it's totally corrected, but at that point we should be able to go longer time between adjustments without worrying about losing that correction. Okay? Now I know a lot of people come to the chiropractor for neck pain and back pain and headaches, and I want to help people with all their problems, with any problems they have. I want them to feel better. But I also want people to understand a broader picture and view of what's going on. So this study I like to show to all my patients called the Windsor autopsies. And what I love about this study, it had nothing to do with chiropractic. It was a medical study done out of the University of Pennsylvania. And what they did is they took 234 cadavers and they classified them on how they passed away. So they had 20 cases of heart disease, and then lung disease, and lung and liver disease, and pancreas. And then what they did is they autopsied the disease organ, say the heart. They examined the disease organ, and then they traced that nerve back to the level of the spine. And what they found out in over 95% of the cases is that at that level of the spine where that nerve came from, that diseased organ, there was misalignment, excessive degeneration, adhesions, and scar tissue in the ligaments. Everything that a chiropractor would look at an x-ray or an MRI report and call subluxation. Remember, subluxation is a chiropractic term, not a medical term. But in their writings and descriptions, what they were describing is what chiropractors call subluxation. And what they concluded is that dysfunction in the spine affected the nerves enough that affected the organ and contributed to that diseased organ, and then ultimately contributed to that death. Now, as a chiropractor, I look at this and I ask myself a couple questions. First, I've been doing this for 34 years. I know these people at some point in their life must have had some kind of neck or back pain that they either ignored or they just numbed up with some kind of pain medication. You see, these were real people. I know that was part of a study, but these cadavers were people that had their lives cut short. They were men and women that never got to see their grandchildren or see their kids get married. And again, as a chiropractor, I gotta wonder if these people got under chiropractic care at an earlier point in their life, how many of them might not have been that wound up in that study? See, I had a patient, Danny, one time. He came in for low back pain, and after about a month of care, he's on the table and he's doing better, and he's saying how much he feels. I said, Danny, how you doing? He goes, I'm so excited. I don't have to have surgery next week. I said, surgery? What are you talking about? He says, well, I have Crohn's disease. I said, you never told me I had Crohn's disease. He goes, I never thought it would have anything to do with chiropractic. He goes, I had Crohn's disease, and I got surgery scheduled for next week. And on my last checkup, things have been clearing up and they don't want to do the surgery now. And I was not treating his Crohn's disease. I never knew he had Crohn's disease. But once we start removing the interference to those nerves, anything can heal. I had another patient, Stephanie. She came in with neck pain and headaches. She's under care for a few months, and she's about to go on the table. And she says, "Hey, doc, I gotta let you know I'm pregnant." I said, "Hey, that's great. Chiropractic, great for pregnancy, great for the mother, and then for the delivery and the whole process." She goes, "No, you don't understand. We've been trying to get pregnant for 3 years now." She goes, "You got me pregnant." I said, "Okay, Stephanie, be careful how you tell that story." But again, I had no idea she was trying to get pregnant. All I was doing was correcting subluxations, removing the nerve interference, and the body did the rest. So the body is an amazing thing, and it's something that we can never, or I never, underestimate its ability to heal itself. So that's all I got.